both of you.
Good evening.
I had a knee replacement 1 year ago, and it's very, very painful. They have changed everything except the kneecap. And I had all the physiotherapy done and swimming pool training and everything done. And everybody's giving me different opinions, so I don't know what to do with that. It's very painful. I can hardly sleep.
Okay.
Any advice on that?
So is the pain is not in control because is the knee swollen? Can you move the knee joint at all? Have you got good movement there in the knee?
I got very good movement in the knee, but they get swollen and it's very, very painful.
Okay. Difficult to say again without actually having looked at any reports or having seen yourself first of all. But I would say that perhaps with continue with the gentle exercises. Perhaps have if your doctor has advised you, maybe use some very simple painkillers, but important thing would be to keep moving and being active and to not keep that knee joint moving and keep making the muscles as strong as it can be. Maybe there are other reasons why you're experiencing the pain, and perhaps the consultant, the specialist who has actually done the surgery would be in a better position to answer this, the actual, reason why it is so painful after a year. But I would say, as a general advice, we should keep that knee moving, make sure it doesn't get stiffer, and keep the muscles in good shape.
Okay, Mrs. Singh, आपके फोन कॉल का बहुत-बहुत शुक्रिया. उम्मीद है आपके सवाल का जवाब आपको मिल गया होगा. Now, before I go to my next caller, I know I have anonymous online. लेकिन Dr. Sanghvi, coming back to Mr. Singh's question, आपने कहा था कि it could be a number of things जिसकी वजह से इसमें. आपके experience में, what are some of the common things that you've seen जिसकी वजह से people don't find that healing has moved as quickly as it should have?
A lot of times people. I think it's the expectation as well, so that you expect you had a lot of pain, which is why you had a knee replacement, and then people feel sometimes that okay, I've had a big surgery, now everything should go in a positive way, and it would. But I have to say that you have to work hand in hand. These are the kind of procedures where you have to the patient has to put as much effort as their physiotherapist or the health professional who's with them in order to get better. In fact, if you had a knee replacement, which in most cases is a planned surgery, before the surgery you should start working on the muscles of that knee and making sure that they are stronger, so that you have optimal recovery post-operatively. So one of the reasons why the surgery, people would take longer to recover is of the underlying weakness and stiffness they have had beforehand. Sometimes, unfortunately, there could be some complications during the surgery which can prolong the recovery, or there are maybe other comorbidities, as we say, so other health conditions which can also slow down your progress.